Good afternoon, Dr. Tyagi. How are you?
Hello, good afternoon. Hope everybody's fine.
Yes, ma'am. Very well. How are things with you?
Everything's okay. Going
That's
on
very nice.
fine. Mhm.
We just some people joining in, and we can then start in another 2-3 minutes.
Yeah, definitely. You would like to continue it in English, or would you like to me?
Can we do it
Would you
mix
like it to be in
English,
Hindi?
Hindi both?
Yeah, but okay. So
Yeah,
the people will be able to understand. Now, most of the people will be understand if I talk in English in between, or
yeah. I
is
think
it
so
better if I
because
talk
it's
in
a mix.
Hindi?
Yeah, because it's a mix of parents from all across the country. There are a few from like South who don't understand Hindi as much. They do, but you know, there is still so they prefer it to be in English. So we can do a mix of Hindi and English both.
So, it should not be that none of them understands anything.
No, I don't think that should be the case. Hopefully,
Uh, what is the majority like? Majority would like Hindi, or majority would like English?
I think majority would be for Hindi. I think so. But as I said, there are still a lot of them who are from South. Like there are parents from Bangalore, Kerala, Triveni.
So if I talk in Hindi, will they be able to understand?
Not really. They would not understand. They would not understand. So that's
And some of them will not
makes it.
understand if I talk only in English. Some
There
of
could
them
be
might not
some, yeah,
understand.
that's the problem there. You know, there are a few here in North who don't understand English as much. So, you know, that's the issue which we have. But so we can
So
just,
should I translate things in Hindi once I talk in English?
yeah, that's okay. But yeah, we can just make it comfortable. I mean, I think we'll leave it open for everyone. If they don't understand anything, we can ask them, they can ask questions, and, you know, we can always help them to, you know, if they're not understanding anything and there is something which is left out, we can always share with.
Okay. One more thing, I already have the questions. So
Yeah,
should I
that's right.
just go on and answer the questions, or would you like to ask the questions and then I'll
Uh,
answer? Like, what way do you want?
do you intend to give a small talk before we start on the question answers, or we just want to get onto the question answer straight?
I don't think I don't have specifics for the talks, because it would be better there. I'm not dealing with these children daily. So
Yeah, I
hello.
can hear you, ma'am.
Yeah. So what I was thinking is, it's better directly the questions are answered,
Okay.
because most of them do know about the disease.
Yeah, that's right. Yeah, certainly.
है ना?
Yeah, I agree with you.
And and these questions are very specific. है ना? I don't want to tell them about Rett syndrome, because they
Sure.
already know most
Ma'am,
of them.
my intent was not to tell them about Rett syndrome, but it's just to, you know, if there are, you want to tell them something specific about how to manage children with special needs. That's all that I was looking at. You know, if you have something specific to discuss or talk to them about. But otherwise, if you,
That has been covered in questions mainly,
yeah, it has.
because
It
those
has.
things are have been covered in questions. It is basically
Yeah,
about that only.
yeah.
Mm.
So we have now with us about. So shall we start?
Yeah, definitely we should start, so that we finish timely.
Yeah,
I
absolutely.
know it's a very difficult time, after lunch nap time.
Yeah, that's true. Sunday afternoon is normally
And
a time when everybody wants to rest, but
yeah.
I would like to thank
We
you,
had
ma'am. I
a
think we've been looking forward to this session for since the last week. In fact, I informed the parents much before that, and I said we are looking forward to meeting you. But thank you very much, ma'am, for having taken out time from your busy schedule for this.
It's always a pleasure, Mr. Sameer. It's always a pleasure.
So I think some of the parents would already be knowing you. Shakun ma'am हमारे साथ काफी सालों से जुड़ी हुई है. बल्कि मेरे को याद है हम लोग ने लोकनायक में प्रोग्राम किया था and she was there with us. Then we did another picnic. I remember that very distinctly. हम लोग ने लोधी garden में and ma'am had come specially for that discussion and she addressed the parents there again. So ma'am really doesn't need any introduction in particular, but yeah, she's working with the Loknayak Hospital, which is presently a COVID, treating all COVID patients exclusively. So she is one of the front end warriors, as the COVID warriors, as we call them, taking care of all the patients with specific needs for, patients who've been infected with the virus. Thank you, ma'am, for being with us and taking the questions. Is the screen?
All of us are fighting COVID in our own capacities.
I agree.
I hope we all win.
Yeah, absolutely. So is the screen visible to everyone? The question screen is there now?
Yeah, it is there.
Okay, that's good. Yeah. So, ma'am, the first question, which is very obvious, is where all the parents want to know about the menstrual cycle. There are these children; they start their cycle earlier than the normal, or what has been your experience on that?
Actually, we need to know how normally it's decided that when the cycle starts. Okay, so for that we need to know why does cycle occur or how does periods occur. So that's a very basic thing. I think I can touch upon it here.
Yeah, sure, ma'am.
So we have the uterus of which has a lining which is shed off every month, which causes this bleeding, and this is controlled by the ovary, in which one ovum matures every month, and because it is not fertilized, it then undergoes degeneration, and then again in the next cycle a fresh ovum is produced, and this cycle is again then regulated by the pituitary. Okay, again hormones are involved, and that is involved again controlled by hypothalamus, and then it is controlled by cortex. So these are various steps. So basically it's brain which controls the hormones being secreted by the hypothalamus, which controls the pituitary hormones, which controls the ovarian hormones, and which controls the uterine lining being shed. So in all, it is a very complicated thing. It is not a very simple thing. Apart from establishment of this cycle, what is very important is what is the weight of the baby. Usually a significant mass of the child is required. Certain weight should be attained by the child for puberty to occur. So although it is complicated, there could be psychological issues which can delay. There could be weight related characters, and there could be certain things which we don't know about Rett syndrome, which could be involved because it's basically brain and neurotransmitters which are involved in Rett syndrome. So varied presentation has been seen, but in general, if the child has a good weight, there are chances that puberty will come early. However, if the child is undernourished, it usually gets delayed. Okay, that's about menstrual cycle. And puberty, when you're talking about, it involves development of breast, development of hair at certain areas. So usually what happens is first the breast development starts, followed by hair in pubic areas, and then later on the periods start. So usually breast bud development indicates that puberty is approaching, and after about 2 to 3 years, the child will start having periods. But in Rett syndrome, it has been observed that this proper sequence might not be always preserved. So things might come a bit early or a bit late. So that might be part of the whole syndrome also. So it is, but definitely if the child is thin, undernourished, usually it is delayed. Okay? And so there is no normal age for children with Rett syndrome. There will be different things. What kind of emotional exposure the child has, what is the underlying pathology which she's undergoing, because all the children are not same. You can't have blanket statements for all children. Okay? So however, if it can be either way, it can be preponed as well as postponed. I think that should be all right. Any
So,
questions
ma'am,
regarding that?
is that, I mean, does it mean that is there no benchmark, or is it normally not said to say that, okay, uh, 12 years or 13 years or 11 years is the norm?
No, it is not that, but usually what is happening currently, the age is reducing over the time, and before 9 if it occurs, then we need to investigate for various pathologies, like there could be something wrong in the uterus, there could be something wrong in the ovaries, there could be a central nervous system tumor, or an hormone producing tumor anywhere else we need to look after.
So
Okay,
anything
so
before 9 years is something of concern. Anything which happens after.
yeah. So it could be just normal physiology that has been slightly preponed.
Okay. Ma'am, again.
And with time, the time of menarche has been reducing. With time, earlier it used to be 12, 13. Now we have very
Okay.
commonly 10, 11 years old girls coming, normal
Okay.
girls also,
Okay.
coming
Okay.
with this problem.
So do you find any indications, or you know that our children are non-vocal, they don't speak. So is there any indications? You said breast development is one indicator, but that's again.
Breast bud development.
But then that also takes 2 to 3 years after the breast start developing, and then But do the signs of to know that yes, they are going to be reaching their menarche?
There could be, there could be like initially brownish discharge, like in the first cycle, first few days, if you want to know. There could be initially first certain increased brownish discharge before proper periods start. Okay. So apart from that, usually it is not there. Pain and all might be presented as increased irritability sometimes. Okay, but there are no specific features which can say, okay, now the child is going to have a periods.
Okay. So it's a difficult thing. Probably the mothers have to keep a watch. Dhyan rakhna padega mothers ko after, I would say, after about 10 years to keep.
Yeah.
उनको इस तरह से दिखता है तो फिर that could be an indication for the first cycle to start. So
Yeah, definitely.
Suggest any particular way to manage the first cycle, or there is a lot of concern, there is a lot of anxiety which the parents have. How will they manage? How is this going to be managed by them? So would you something के ये पेरेंट्स की जो एक बहुत उत्सुकता रहती है कि कैसे हम करेंगे उसको, वो कैसे हमको बताएगी, तो वो कैसे उसको मैनेज कर सकते हैं? आप कुछ उसके लिए बताना चाहेंगे?
Look, physiologically, it is the proper evidence of bleeding, by which they will come to know that periods are going to start, okay, or they are starting. Now I can talk about personal hygiene. There have been questions later on also.
Yeah.
What I would like to tell prior, and we should know what all problems can occur apart from normal hygiene,
Yeah,
which
that's right.
is a problem. Okay, so sometimes when periods start, because the hypothalamo-pituitary ovarian cycle and the uterine cycle, it's not mature. It is occurring for the first time. So sometimes what happens is when periods start, they do not stop. Okay, the cycle is not established and the bleeding starts and it does not stop. So the child goes on bleeding. Secondly, she might be experiencing severe pain, which is not able to express. Then there can be mood changes during this time, which have to be taken care of. So these are the few things which the, and one more thing, because definitely some amount of blood, about almost 80 ml of blood is lost in every cycle. Loss of blood can lead to development of anemia, because there could be already existing undernourishment and lack of hemoglobin, lower hemoglobin. So it is imperative that as the child reaches puberty, her hemoglobin is adequate. She has her iron rich diet is taken care of, so that periods in addition do not further deteriorate the nutritional status and she does not land up in anemia.
Okay.
So these certain things need to be taken care of and it can be prepared for.
So what you're saying is maybe once the periods start, maybe they need to get a CBC done just to check that the hemoglobin levels are all right and the iron levels are all right.
It's what rather I would say is normally diet should be iron rich, and we should make it more physiological than test base.
Okay.
And rather than going for tests and all, you should the normal complexion of the child should be pink. She should not be pale. Clinically oriented, it's better, because going ahead with a test is also such a painful thing.
I agree. I agree.
Isn't it?
Yeah, that's true. That is true. So how long does one cycle is for how long? You mentioned one of the abnormalities could be that there is continuous bleeding, but if it's
yeah. So yeah. So a cycle, one episode of periods in a cycle can last up to 5 days, 5 to 6 days, and usually the flow is more on 2 days or 3 days maximum. Prior to that, there might be slight spotting, and after the periods, there might be small amount of spotting for 2 to 3 days. So it comes to around 5 to 7 days at max, but it can be only for 1 to 2 days. If it is less, it doesn't matter. If it's more, it should not be more than 5 to 7 days, in which only about 1 to 2 days usually the periods, there could be 2 to 3 changes or more, not more than 3 to 4 changes per day. If it's more than that, that suggests that period is more than normal. Or if there is passage of clots, in that case also it suggests that the flow is excessive. Or if in spite of changing after every 4 to 6 hours, there is seepage, there's overflow, that suggests that there is excessive flow. Or if the child is looking pale after the periods, that suggests that the flow is more. So usually it is about 2 to 5 days.
And
that's normal periods, and the cycles is normal cycles is between 21 days to 40 days. So it can be from first day of the cycle, from the first day of one cycle to the first day of the next cycle.
Okay. Okay.
If it is, the duration is 21 days, then it is considered as normal. From first day to the first day of the next cycle. We should not count from the end of the first periods to the start of the next periods. That's what we do usually. And when we say, okay, the period is occurring every 15 days or so, usually we should count the cycle from first day of the previous cycle to the first day of the next cycle. So if this is 21 days cycle, then it is considered to be normal. And if it is increased, it can increase to about 40 to 45 days. So within this range, we don't need to do anything until give symptomatic relief and a reassurance. Okay.
Okay. Okay. But if it happens,
So that's.
but if it happens earlier, like one of the parents has mentioned that she's getting nearly once every 2 weeks, every 50.
That's what.
Yeah.
Yeah, that's what happens is, it is actually not once in 15 days. What is recommended is to actually make a chart or mark in the calendar when the period starts, when the period ends, and when the next cycle starts. Okay, so if it is less than 21 days, then she needs further workup to know why the cycle is reduced. Okay, and accordingly, specific treatment needs to be started.
Okay, so they need to, if like for example, here the parent is saying the angel is about 10 years old and she's having continuous periods every 15 days. I understand.
So it could be it could be 2-3 things. Either it's happening every 21 days. So the time of duration of the periods also they are counting.
Yeah,
So
maybe,
they are
yes.
they are starting from the end of the period. They're thinking, okay, this day it is ended, and now again after 15 days it is started. So if the period lasts for about 5 to 7 days, and after
Yeah,
15
so,
days they occur again, so they'll
yeah,
count it as so if it is actually or if it is not so, that means the uterine endometrium is hyperplastic. There's only estrogen which is acting, there's no progesterone, so she'll require hormonal medication to
okay,
stabilize
okay.
the uterine
Uh,
lining in that case.
but there is also one
So
question.
she might require an ultrasound to decide
Okay, okay.
how to go about it. So first step would be to have a menstrual chart
Yeah, I agree.
to know the
Yeah,
pattern of the bleeding. By just seeing the pattern also we can know, we can decide, and we can give a trial of hormones also before going ahead. And in the times like today, these days, we're having difficulty in getting
okay.
scans and all and investigations done. So we can give a trial of hormone therapy, and then it can be taken care of.
Ma'am, a related question which comes up then is that if the, one angel has reached her at 11 years, but she's not had any period. So can this also be a situation? Can this also be something of concern?
Yeah.
If you've had,
Actually,
it has happened only once and it has not happened after that.
We must understand one thing. The periods have only one function, that's a reproductive function. Okay, it doesn't have any other function. And we must understand that. And it is a very complicated thing. The whole thing is a very complicated thing. So any emotional disturbance, any hormonal disturbance, any medications she's on, and being underweight, okay, all these things can result in a lack of repeated periods. Now here, when all can we have a problem? Okay, if suppose there is an obstruction somehow, some obstruction has developed, and every time she's having period, but the blood is collecting inside.
Okay.
Okay, in that case, it is a problem.
Okay.
Secondly, there is a systemic disorder, like tuberculosis can also cause this kind of a problem. Okay, so if she's losing weight, she's having cough, so this systemic problem can cause this. Then PCOS can also cause this. PCOS is usually associated with increased weight, hair hirsutism, acne, all these things. So in that case, there could be systemic manifestations of PCOS if they are not taken care of. Any hormonal tumor can also cause this. They can cause the preponing of periods as well as stoppage of periods also. Then there could be other problems. So these are few issues I lined up. So a basic workup is required to know why it has not happened. So if the problem is just neurological or hormonal, certain drugs, anti-epileptic drugs,
Yeah.
can also cause this. Certain pituitary tumors can also cause this. So there are multiple things which can lead to periods not occurring properly. Okay. So a proper workup needs to be done. She needs to be seen once to rule out anything which is not, to exclude a thing which is something serious.
So
Okay,
I would just say what you're saying is that this is not a normal condition. It is something of concern and it needs to be investigated. So the parent needs to look into it. Why is it happened like this? We need to find out more.
So once, definitely once, it might not be a very serious thing.
Yeah.
Okay, it might not be a very serious thing, but we need to rule out the serious things.
Okay.
You understand that?
Okay.
Most of the time, it is not a serious thing.
Okay.
Okay, most of the time, it is not a serious thing. I don't want to alarm, but
yeah, but
I understand. In a while,
yeah, it's something which is not normal, and we need to investigate. We need to find out why is it happening like this, and then
definitely,
corrective.
definitely,
Uh,
definitely, we should not miss out on something.
Yeah, do these irregular periods also lead to hormonal imbalances?
The hormonal imbalance is causing irregular periods.
Oh, I see. Okay, so it's the other way around. And
because it's all hormones which is causing.
You also mentioned that the anti-epileptic drugs could also be one of the reasons. Irregularities.
There are certain drugs if they can cause.
So who would be addressing that? Would it be the neurologist or would it be a gynecologist who would suggest some remedials on that?
Either of them. Actually, if we know the cause,
okay.
If we know that it is a side effect of an anti-epileptic, we don't need to worry about it.
Okay.
Because if we do not know what is the cause, then we need to try and find out.
I agree with you.
Because we can't stop the anti-epileptics.
That's right. That's right.
Because taking care of the seizures is more important.
Very true.
Okay.
Very true.
So, if the periods are slightly irregular, it doesn't apart from the inconvenience of having an irregular cycles, there's no problem. If even periods stop and there is no physiological abnormality, there's no problem at all. Nothing, in very rare instances when there is physical obstruction, does the blood collect inside. Usually it is hormonal problem, and if the period do not occur and if the lining doesn't get thick, it is most of the time not a problem. The periods are not happening because of any psychological harm, hypothalamic pituitary ovarian axis is disturbed or anything. Okay, so we do not need to worry so much. If
but we need to find out
regular cycles,
yeah,
we just need to find out that there should not be anything which is very significant, which we are missing out.
I agree with you. Ma'am, there was one question in between where they say wanted to know if they are going for a second pregnancy. Would you suggest any specific precautions or tests to be done or any Any advice from
Yeah.
your side, what they need to do and what
Yeah.
they should do and what they shouldn't?
Yeah. 99% of the cases, these are sporadic problems.
Yeah, yeah.
Whatever is happening is sporadic. And although tests are available, okay, once we know the mutation which is occurring, we can take cells from the developing fetus and test for the presence of that gene or not, that mutation or not.
The
Okay,
prenatal
but
test.
the CVS
Yeah,
chorionic villus sampling can be done before 16 weeks,
that's right.
preferably between 12 to 16 weeks it can be performed. But there are certain things which we need to understand. Because they are sporadic, okay, most of the time it will be 99% of the time it will be normal, except if there are more than one people who are involved in the family with the same disease. Okay, if this is an isolated problem, it has never occurred before in the family, then the chance is very less. Okay, number one. Number two, the test itself can cause loss. Thirdly, sometimes because the test is performed not from the fetus but from the placenta. Okay, so very rarely there might be false negative also.
Okay.
However, uh, most of the genetic disorders, if you want to be 100% sure, and we have the genetic mutation which is available, they can be diagnosed whether the child, the baby, has it or not. Okay. So because we already know the mutation from the child which is available, which is there, who's there, so we can always go ahead with. So it has to be counseling at that time with a person who's going to conduct the test. So it is there's no yes or no about it. So there are always pros and cons of everything. So the couple has to decide whether they want to go ahead or not. Like that.
Pregnancy, do you suggest anything like prenatal and you get it done? God willing, the reports also are clear. Do you suggest anything in particular to take care during the pregnancy?
No, that will be a routine pregnancy.
It will be a routine thing.
It should.
What about the delivery? I think most of the cases they suggest for a C-section. Is this what you also suggest? If the term is, should they go for a C-section or should they go for a normal delivery?
That's $100 million question.
In fact, we just last week, we had one of the parents who delivered and she also opted for a C-section and she said, we've decided the date and I didn't ask her whether it was a doctor who suggested this to her or was it their own choice. I don't know about that. But I've seen most of the parents opting for C-section being suggested by the gynecologist also. Do you think it's something which is...
mode of delivery in any child depends on so many things. There are 100 things. It's all obstetrics.
At that last moment, if there are no complications, if everything is going fine, I think the first option should be for a normal delivery. But if there are any chances, any complication which develops at that moment,
in that time we must understand few things regarding this. Normal delivery or labor as a process, labor is associated with contractions, and every time a contraction is occurring, the blood flow to the baby is stopped. Okay, and it gradually increases. So anytime there could be hypoxia. So if and secondly, the pelvis should be good. There should be no other complication. There should not be any previous scar. If everything is normal, Everything is, and patient has gone into spontaneous labor, and there is good monitoring available, good OTs available. Definitely normal delivery is always better, because there is always a chance of complication in mother and the baby, both surgical and anesthetic complications, which can occur during a cesarean section. Vaginal delivery is far more physiological as compared to a cesarean section, and this baby is going to be a second baby always, most of the time. So a second delivery is always easier as compared to a first baby. However, it requires very close monitoring. So after every half an hour in first stage, and after every contraction in second stage, you have to stand there and listen to the fetal heart, see the CTG. Only then, with such a rigorous monitoring and with an OT and blood and everything in obstetrician and anesthetist available at any time, there is a problem, the child to be taken up, the patient to be taken up for cesarean section. So it has to be on your toes for 24 hours almost.
And
so
it's
this can
a
be done
spontaneous,
only
it's more of
and we never
decision at that
we never know when it is going to occur, what time, as for the family, for the obstetrician, for the anesthetist, for the team. So this can occur when there is a big team looking after lots of patients. So in a small setup, it's very difficult to have a safe time deliveries until unless you are especially in current times.
That's right.
It's very difficult. I told you last, my sister delivered.
I know that now. Yeah.
So she had a normal delivery.
Oh, that's wonderful. Okay.
But we were on our toes for the whole time, and it was a forceps delivery.
Okay.
So okay, now both are fine, but we were able to prevent the cesarean. But we were like, okay, a cesarean, half an hour or 1 hour cesarean would have been better than 12 hours of this. She underwent epidural also, and she had so much of pain, and now also this pain and stitches. But she had a normal delivery. But there are pros and cons for everything.
I agree with you, man. I totally agree on that.
We both were like we were thinking a cesarean would have been far less of a problem than this vaginal delivery.
I think many times this is normally what happens at that moment because even the obstetrician feels it's a safer way. The monitoring.
It's a precious pregnancy, no?
Yeah,
it
that's
becomes a precious pregnancy,
that's
and
right.
You don't want to take chances.
Exactly.
That's what. No, you don't want to have a baby with a cerebral palsy.
That's right.
That's right. Any hypoxia can result in cerebral palsy, and you can't have a second baby who's like that.
Yeah,
so
very
that's
true.
a very important thing,
Very true.
So it's how much chance you want to take.
Yeah.
So we can go ahead with a normal delivery with a very low threshold for cesarean section. So that things are like leaving too much to chance.
I agree with you.
Too much of adrenaline, too much of risk taking.
That's true.
So
That's true. Yeah. And I think most of the time, even the parents want it to be like that. They don't want to take any chances.
Yeah,
they also
nobody wants to take a chance.
That's right. Yeah.
And now we are not having more than 2 to 3 children in our societies.
That's right.
So better go ahead for a safe delivery, especially in a case when previously there has been a problem.
I agree with you.
Unless the lady herself goes into labor and progressing and doing fine, then there's no problem. If that's happening, we can't stop. You need not stop a normal baby coming.
That's
if it's coming normally,
you
should not stop it. But if there's no point in taking too much of hassles in persisting for a normal delivery. But that's what I feel. Safety of the mother and the baby and the obstetrician.
I agree with you, ma'am. Ma'am, there was another question which was coming in about the mood swings which we see in these children during the cycle. So would you suggest anything about that?
Uh, First is related to pain. There could be pain which is happening just prior to periods on first 2 days of the periods. The mood swings could be associated with that. So the pain should be taken care of. Simple analgesic initially can be given, like paracetamol or any antispasmodic can be taken for that. Apart from that, I don't think we should go ahead for any kind of medication for this as
Okay.
such.
Okay. Only
So
pain management
that
is
would
something
be
which
too
you can.
invasive.
Yeah. Yeah.
Yeah. If pain is taken care of, definitely things would be better.
Now the next question is a little relative when they say, that should medicine be given for heavy bleeding? Now, heavy bleeding is a very relative thing. I mean, what is heavy and what is not is something which,
So I talked about it. है ना?
yeah,
So if
yeah,
there is
and you
passage
did
of
mention about
clots,
it, yeah, that
if more than 3 pads are being used, if there is spillage,
okay,
if there is periods the same kind of heavy periods, they extend for more than 2 days, 2 to 3 days. So, and a child who's already anemic, even lesser amount of bleeding might be heavy for her.
okay,
Okay. So it's these drugs which reduce the flow.
okay,
Tranexamic acid is the antifibrinolytic drug, which
okay,
is used to reduce the flow. They are physiological. Okay.
okay. But I think we need to first
The only
investigate.
problem.
Yeah, we need to investigate
Only problem.
this. Yeah.
No, we do not
Okay.
need to investigate. We can go ahead with this medication.
Okay.
And we can start from a smaller dose and gradually increase it to 503 times a day.
Okay. Okay.
What I want to tell is sometimes they can cause thrombosis because they can cause clotting.
Okay.
They are antifibrinolytic.
Okay.
They reduce bleeding, but they can cause clotting also. So what thing is important is good hydration has to be maintained during this time.
Okay. Okay.
Okay, if these drugs are being used, good hydration has to be maintained.
Fine.
There should not be history of clotting disorders in the family.
All right. Okay.
Okay, so
Yeah.
if the child is predisposed to clotting because of her inherent factors, then it should be avoided, and a good hydration, lots of fluids should be given. So because hemoconcentration causes clotting,
Okay.
and certain things like headache, she won't be able to tell you if she's having microthrombi and there is headache. She might not be able to tell you properly if there are microthrombi because of this drug. So we need to take care of the side effects.
But do they have headache otherwise also?
Should not.
Without, because I spoke to my neurologist and he was saying that in a lot of cases, there are also incidents of migraine in them. Is that true?
So if there is migraine, then you have to be more cautious because then the chances of clotting increases further. So definitely this could be one of the manifestations. Migraine is a totally different pathophysiology.
So it's not related to the cycle as such. It's
If the child is already having episodes of migraine, sometimes periods can precipitate migraine attack.
okay.
It's like
But
that.
but it does not happen the other way. So periods will not
No.
migraine.
No.
Okay.
If the child
Already has
is
it.
already having migraine, then sometimes it happens that
Okay.
the
It can
periods
aggravate
might,
the situation and lead to
yeah.
more frequent attacks on that. Again, there's an ethical question. I remember having discussed this with you. Is there a way to stop the periods altogether?
You know, there's one thing called hysterectomy. You remove the uterus, but it's too invasive and it is unethical. Usually, the law does not allow. Then there are certain things. Hormones can be taken. So they can be taken by oral route. They can be patches are there, or inserts are there. They can be implants, can be put under the skin, which gradually release the hormone, or under anesthesia they can be inserted inside the uterus, which causes slow release of hormone and does not affect the systemic function. And gradually the periods are very less, or they stop, and they provide the contraception also, and they're effective for 10 years maximum.
And
So
do they have any
things,
side effects? Because you're stopping?
if it is, yeah.
It's a natural
So
process which you are obstructing, if you ask me.
no, it is not like that. It's not that. Natural processes required for fertility.
Okay.
Okay, so that cycle, whatever is there, it continues. By giving the progesterone, we are just affecting locally, the uterine lining is affected. So the lining is not shed off every month.
Okay.
So if the systemic hormone is used, then it is going to affect the whole system. It might have some side effects, but if local implant is utilized, then the side effects are rather not there.
Okay. There is also one question which states that their angel is 13 years old, has not started her periods, but there is a white discharge which happens for 2 to 3 days after every 15-20 days. Is this normal? And is it any indication of her starting her cycle? They also say that she's very restless. Her condition is like having a seizure. But they've consulted the neurologist, and the neurologist is saying it's not seizure. It could be, her reaching her menarche. But what do you think? What could be the reason for this?
Yeah, there are two things we need to take care here. Okay, cyclical pain. If she might be having cyclical pain. Okay, sometime there could be two origins of cyclical pain. One is ovulation, some kind of ovulation, early type of ovulation is occurring. Okay, but usually that occurs when once cycles have started. In this case, cycles have not started yet.
Yeah.
And other cyclical pain could be if the blood is getting collected inside, and because of that she's not having periods, but there's some obstruction. Okay, so if they can always go ahead with an local examination or imaging to see whether there is any collection inside. If it's not there, then the discharge could be gradual estrogen activity because of the developing hypothalamic pituitary ovarian axis. Okay, so it is likely over the period of time she's going to start her periods.
So this could be one indication.
It could be one indication, a normal discharge which occurs because of estrogen.
Provided
and
no
secondly,
yeah,
the nature of discharge is very important. Is it mucoid, or is it foul smelling? Is it itchy? Is it greenish? Is it yellow? Okay, we need to take care of anybody's tampering with the child. So all these things, because of that, we need to
So
take
the
it off.
restlessness and the similarity of having a condition like seizure could be because of the pain that she's having, which is the cyclic pain.
We can always, we should rule out, we
Yeah.
should rule out local pathology which is causing cyclic pain and
Okay.
restlessness and the seizure like problem.
Conditions. And about the discharge, that needs to be investigated. You need to find out what is the kind of a it's a mucoidal, it's itching, is it, what is the
yeah,
color,
yeah,
what is
yeah.
happening, and then probably take a decision what needs to be done for that. And there was also a question related to wearing these diapers. Most of our angels, they are in diapers for nearly 24 hours in a day. What would you suggest? Is that a good thing to do? And secondly, does it also lead to any kind of UTIs? Is there a risk for, and how can it be avoided?
We do not have much alternative to it.
Yeah.
So this is something which we need to do. That's what I discuss, and whatever I experience, I have the same thing that we can use 2 diapers during the periods. We can use double diapers, the one which is used, the heavy ones, or we can have the better ones during the periods to avoid spillage. And alternative would be for local hygiene. This is something must. I don't think we can avoid or do away with it.
So the basic thing is maintaining hygiene. You think is more important than because it's a necessity in our case, in our children, because they're not they're toilet trained. So
The other thing would be tampons, but I don't know how healthy it would be, and it would be difficult to use them with the hymen and all.
I
So
agree.
it would have they would be more difficult to put tampons rather than just use a sanitary napkin along with the diapers.
But does it lead to any kind of infection, a urinary tract infection or anything? No,
No, it should not.
it should not.
If it's adequately changed adequately, then it should not.
Okay. Do you suggest any tonics? There are a lot of these ads that we're getting these days on TV for different, tonics. And do you suggest anything in particular for them to be given?
What I feel is diet, or the absorption of various vitamins and everything is always better from a diet. Okay, and a well-balanced diet is most important. So we can have a diet chart with the help of a dietitian, so she can suggest exactly what kind of foods the child should take and what kind of preparations can be made for it. We can have a special dietetic referral rather than going ahead with tonics. Definitely, if for iron supplementation, if the iron intake is not adequate, it can be taken, a multivitamin might be added to it. Apart from that, I don't think there's any requirement of any other tonics. Our diet, if the child is not taking enough green leafy vegetables, then the diet might not be good enough in iron. So what can be done? Iron utensils can be used to cook the food. That might change the color of the food a bit, but the content of the iron would improve. So that will reduce the chances of anemia because of the periods. Apart from that, I don't know, tonics. I don't believe in tonics.
We had a
Rather,
session.
good diet. Mm.
We had a session with Anusha ma'am from AIMS. I'm sure you know Anusha Agarwal. And she was suggesting you could probably increase the intake of potassium during this time. Is that correct? Is that also what you suggest?
I'm not aware of that.
Okay. Okay. This is what she said. She said you could probably increase the intake of potassium during that time, and it helps them. I think she was talking about things like pineapple and all, which should be helpful for them at that point.
Banana is best, and
Yeah, banana also she mentioned.
banana has got very good potassium
Yeah,
intake.
that's right. That's right.
I'm not aware about potassium,
Okay.
improved
No,
potassium
she
intake.
specifically mentioned about pineapple and banana, both. I remember that. Okay, you've answered this question about the anti-epileptic drugs. It could have an effect on
Yeah.
Minaki. It could be one of the reasons for having a problem. Could be the anti-epileptic drug which is being given to them, but that could be just one of them. And we need to find out if there is any issues up. Then we need to find this out and work it around with.
And we need to take into consideration that taking care of the epilepsy takes a priority.
That's right.
Okay. And if the periods are not occurring properly because of the anti-epileptic, then it becomes secondary.
Okay.
Because the main function of having periods is to have fertility, which is not primary in our case.
Absolutely.
It is the well-being of the child which is
Absolutely.
primary.
Okay.
Okay, so the anti-epileptics takes a priority.
Okay. Do you suggest any particular, to maintain the hygiene, especially during the periods? Do you suggest anything to the parents, what they need to do and what they shouldn't do?
It's always better to avoid using clothes and all for and rather have a proper sanitary napkins which should be used, and there should be around the change should be according to how much has to be seen, how much flow is there according to that, and at least twice to thrice a day change must be there. And a sanitary napkin will have to be used along with the diapers during the period. It's always better to use the sanitary pads which have cotton base rather than the synthetic base. So there's less chances of allergy to the child. Because she's already exposed to the diaper. Yeah,
that's right.
She's
That's a very
exposed
good
to the diaper, and so we can take care of these few things.
There are these, personal hygiene. I don't know what to call them. I think V-Guard or
Yeah, I know. We wash and all.
We wash. Yeah.
These are various. Yeah. So ideally, they are not required.
Okay.
No soaps. One should avoid soaps.
Okay.
And if adequate estrogen is being produced, okay, the lining is okay, and the periods are occurring. So these synthetic material must be avoided. Sometimes the child gets allergic to them. What we should do is simple plain water must be used.
Okay.
To clean. And because too much of soaps and all can alter pH, having curd, I don't know whether these children accept curd and fermented things.
Yeah, they are okay.
Food.
Except I think if they have any allergies to milk products, they're okay. Most of them, they like to have curd and milk.
So it has been found that fermented food
improves
the vaginal flora. So if there is no discharge, yellow or curdy white discharge, if there is no itching, okay, then plain water, simple water should be used.
Okay.
And these we wash and all can be avoided. Otherwise, if recurrent infection is occurring, then these help to maintain the pH. And so not primarily, but in case of recurrent problems, they can be used.
Okay. Okay. Ma'am, this is a question. I don't know whether it relates to you. Is delayed urination any indication of a medical condition?
Delayed
Urination. They're holding the urine for a very long time.
I don't think I'll be able to answer that.
Okay. Okay.
But I don't know.
We see frequent urination to be one of the indications we have in our children, where we see them if they are urinating frequently, it could be because of or a UTI or some other issues. But this is a very different kind of a question which we had from one of the parents. Anyway, so
maybe the child is not having the urge to urinate.
Or maybe
so
there is not enough water intake. It could be, that could also be another reason.
It could be delayed. It could be the output itself is reduced because intake is not adequate.
That's right.
Definitely.
Okay. Okay. So yeah, anyway, I'll ask them to check up with maybe a general physician would be able to tell them better about this, or a urologist. Thank you, ma'am. These are the questions which I had, but I'm sure there would still be some more queries from the parents who are there with us. So we'll open for the parents to ask their questions. Please go ahead. आपको कोई भी क्वेश्चन जो मैम को आपको लगता है कि अभी आंसर नहीं करा है या कुछ और आप पूछना चाहते हैं तो प्लीज आप पूछ सकते हैं मैम से.
Doctor, I have one question. Hello.
Yeah, we can hear you.
Yes.
Yeah. Using wet wipes for kids, is it advisable, or should we avoid that? Wet wipes.
Basically, these wet wipes have a slight amount of alcohol.
Okay.
So they are very comfortable because they are clean, they are handy, they are easily available, they are soft. But what they are doing is they are taking away the natural flora of that area. Okay. So they are disturbing the natural flora which is available there. So what happens is when the natural flora is all taken away, there are higher chances of pathogens which can take over.
Okay.
So that is the only thing. But currently, with all these wet wipes and sanitizers and all are being promoted because of coronavirus. But otherwise, routinely, every time you use a wet wipe in genital area, it is not preferable. That will not let the normal flora, the normal flora, the normal bacteria, the number of cells of the bacteria are more than almost more than twice the number of our own cells in our body.
Okay.
So every time we are taking antibiotics, we are killing the normal flora which is living with us. So when we are using something which is like wet wipes, which is alcohol, we are removing all that normal flora also. So thinking, and that way it is slightly unnatural. Simple plain water, rather have some slight cotton or something which tissue with clean water would be preferable than these available wipes. They should be used in pathological conditions rather than daily use and physiological. Okay, when you want
Okay.
to make sure that all the organisms are removed from that area, then it is going to remove the good ones as well as the harmful ones. So when all the good ones are removed, later on the harmful ones will take over. So it is always good to let the good ones remain there. So we
Okay.
should avoid using too much of unnatural things, too much of soaps in genital area, too much of wipes in genital area, near genital area.
Okay. Thank you, doctor.
Uh, rather, they have things which improve the lactobacilli growth, which is the normal flora, and improves the local, especially after puberty. That's a
Okay.
slightly
Thank you,
different
doctor.
question. Yeah, but it's very difficult to make people understand that please, over hygiene is not so good. People use antibiotics so indiscriminately now, they kill all their flora.
Hello, doctor. It's Atul here. Do we have any medical test by which we can in advance aware that after how many years this cycles will start?
No,
Any blood test or
no,
something?
no.
Okay. The reason behind asking is that so that parents will be ready that by that time, because it's not clear that it's 9 year, 10 year, 11. So that's
How matlab, you want to perform those tests frequently. Actually, what happens is the issue is that their hormonal changes are cyclical. So you don't know when you are going to take any sample. Then it is going to tell you the exact status of the diurnal cycle of the levels of that hormones. You want to know where to predict. You want to predict whether the cycles are going
that's
to
right.
start or not. Mm,
Actually, I
I
had
don't
a
think
word with
so.
one of the doctor. She told me there is some blood test can happen at the age of 7 or 8 that can help us to understand after 2 years she should be start or after 3 years. So that's where I was in a mindset.
Mm, normal LH, FSH, I don't know. But it can't predict so certainly.
Okay.
There are definitely once the cycle starts, the LH and FSH level, like they start increasing. But I am not sure they would be really able to predict, okay, after 2 or 3 years. They are not so sensitive or specific.
Okay. Thank you.
Okay,
And
because
another quick.
definitely there are infantile levels of hormones, and there are definitely pre-pubertal levels of hormones. But you cannot be sure that okay, within 2 years or 1 year she's going to start or not. And 2 to 3 years is a very long time
That's
to
right.
predict.
That's right. And quick question is that because our all angels are on therapies, so during this time, will you recommend to
On
continue on physical therapies and this all therapies we are doing on daily basis? So on this particular period time, should you recommend that we should continue this therapies or should we stop?
nay, definitely if the child is comfortable with it,
Okay,
okay, if the parents are comfortable with it, it can be continued. There's no medical contraindication to continue with various occupational physical therapies or behavioral therapies.
sounds good. Thank you.
There's no contraindication.
Ma'am, there's a question from one of the parents. I think she's having a problem with her mic, so she's asked it. My daughter is 14 plus, and she is having her period very irregular periods. Sometimes it is after 60 days, and sometimes it is under 45 days. Uh, So is this a problem and what should I do?
Is she on any kind of other treatment also? Is she taking any anti-epileptics and all?
I think she would be. आराध्या जी, हेलो आराध्या जी, आप मेरे को सुन सकते हैं? हेलो आराध्या जी, आराध्या जी, आप मेरे को सुन सकते हैं? I don't know. She's not on.
So and there's so many things which need to be taken care of. What is the weight of the child? Is she overweight? Then abnormal cycle itself otherwise will not cause delayed cycles itself is not a pathology in itself. However, what it's causing it, that's need to be found out. Okay, if suppose she's having PCOS, if there is hypertrophy, we need to know whether there is any lining of the hypertrophy of the lining of the endometrium, if that is occurring by ultrasound, then she needs a therapy for it. If it is thin, then it doesn't matter. Sometimes children do have naturally prolonged cycles also. Most of the time it is between 21 to 45 days, but sometimes rarely the cycles could be and there could be no underlying abnormality also, but we just need to rule out any hormonal problems, any okay, we need to rule out. Basic hormonal workup needs to be done, a physical examination of the child and hormonal workup. Is she obese? Is the child obese? Is she having galactorrhea? Is any discharge from the breast? Any pituitary tumor can also cause this. PCOS can cause this. Any anti-epileptic, if she's taking, that can cause this. If all these things is ruled out, then we don't need to do anything about it. It will not harm.
Okay.
I have a small quick question. Means there is any way to reduce the cycle? Means like you mentioned that it can be 3 to 4.
Yeah.
Because our
So
kids are
whether
already sorry.
yeah. So I talked about it. Basically, it is at the hormones can be given. Basically, I talked about it like so that the children do not have regular periods. Hormones can be given. Now, in that case, we just need to take care what other medication they are on. There should not be an interaction with other medication. So those hormones, progesterones, they can be given orally. They can implants, or they can be inserted inside the uterus also.
No, my
So
point is that suppose the cycle is 5 days, can we reduce that to 2 to 3 days so that it will be short?
you mean to say the duration of
cycle.
period?
Yeah.
Duration of the period?
Yes.
Okay. So antifibrinolytic agent, the same drug which is used to reduce the amount of bleeding, can also reduce the duration of bleeding, the amount of bleeding, and the duration of the cycle which you're saying.
And is it recommendable?
If there is a lot of inconvenience, why do you want to do it? Just to remove the inconvenience.
These kids are already in so much pain and all these things. So instead of giving
so it will not reduce, it might not reduce the pain. Rather, you should give the medicine for pain for that case, because giving unnecessary medicines can also have some harmful effects.
Okay.
But if the periods are heavy and they're more than 5 days, definitely it can be given.
Okay, thank you.
We have one more question.
Yeah,
where it says, Is it?
Yeah, I read it.
Yeah, you mentioned about it to say this is unethical and it's not allowed by law, but I don't know what to say to this more than this.
But they do not, just removal of the uterus will not cause weight gain.
Okay, fine. I think that's a good way to just put it out. But it's not allowed by law. Let's put it very clearly that the law of the country does not allow this to be done. So
Sometimes people have gone to court and they've got orders from the court if that can be done. Sometimes such kind of procedures have been performed.
And if my understanding is correct, if we will stop all these cycles, then it will impact the bones also, right? That will give.
If yeah, it depends on what is a way, how we are trying to stop the periods. Like if only the uterus or its lining is taken care of, then it will not affect anything. If ovaries are affected, then the bones will get. So the ovarian cycle carries on. The estrogen is being produced, everything is normal. So if we there are even now there are procedures, invasive procedures, where we can do ablation of the endometrial cavity also. They're slightly more invasive than using just progesterones. Okay, so the procedures are there. Balloon ablation, even TCRE can be done. These are the procedures which are performed in patients who have excessive bleeding. So if you want to get rid of periods, only the uterine lining will be destroyed. Okay, the hormones are not affected. So the bones are not affected at all. Okay, so there's no connection between bleeding and bones. Direct connections. It is basically the hormones which are produced by the ovary. They strengthen the bones.
Okay.
The ovaries are never removed.
Okay.
Even in hysterectomy or if any surgical procedure is performed to remove the endometrial lining.
Got it. Thank you.
any more questions from the parents? Any other query?
Yeah. Hi, doctor. This is Shifali Sethi.
Hello.
Hi, how are you?
How are you? I'm good.
And Dr. Samiksha is now 25.
Yeah.
And so far I'm handling it, I think, pretty well. But as age is catching and she's also becoming not difficult at all to handle, I won't say that. But yes, for periods, I think ultimately even I would want to get it operated. So you feel it should not be happening?
I think currently we have much better things available rather than removing the uterus.
Yeah, I mean to say,
That is,
yeah, not uterus, but yeah, also so that she is not physically abused as later, whatever. For both the purposes, I feel, what is the best solution for that? Because even we are growing old. If she's growing old, so are we.
well, I had told you earlier also, local progesterone insert is best. It acts as a contraception as well as it gradually reduces the periods. And the menstrual function is also taken care of. Local progesterone insert, Mirena insert, that's the best. It needs certain anesthesia, and
Okay, so it's a
that can be
surgery.
done.
It's a surgery.
It's like insertion of copper T.
Okay.
But because these children are unmarried, so the hymen will not be intact, and hymen will be intact. So it will be a slightly painful procedure. So it should be done under anesthesia. So it's a small device, about like similar to copper T, which instead of copper has progesterone, and it's inserted inside the uterus. And over the period of 6 to 9 months, the periods gradually reduce, and then they stop hardly any spotting occurs, and it gives contraceptive function also, and doesn't
And
have any systemic side effects.
no side effects at all
And it
of
does
her
not
weight
absorb
gain,
into the
her weight
system. A
gain.
very
Yeah.
small, a few, very few microns, 20 micrograms is absorbed into the uterine lining, and only the lining is suppressed. It doesn't grow. So that would be the minimum invasive thing and best, which I would think. Others would be surgery, which could by which we can destroy the lining, which are also available.
And ma'am,
Thermoablation, and there are various ways. Laser ablation,
and what is the
cautery,
good
the ways.
what is the good age to get this done? I mean, she's 25. Rather, she'll be 26 in December. So, is there any particular age or any time now she can get it done?
Whatever you are talking about, ablative techniques, or you are talking about insertion of progesterone?
For her periods to start, and yeah,
I think
for her insertion, you would say, yeah.
and it's I think it can be done earlier also. Don't need to wait for that long. The child needs anesthesia, the child needs a workup, and if it can be done, and the uterus is well developed by about 16 or so. So
Okay.
after that, it can be done anytime.
Anytime. So she's 26, so we can manage it. Thank you. Thank you.
Any other question from anybody else? If not, we don't want to hold Dr. Tyagi for any longer. Thank you very much, ma'am. You've answered the questions in great depth and in details for all of us. I think it's been a really wonderful session, which all of us have been waiting for a very long time. And these are matters which concern us in a very big way, and not very often do we get this kind of opportunity to be discussing heart to heart with a person who can understand what we are talking about. What is the pain that we have at our end? Thank you very much, ma'am, for your time. Thank you, everybody else, for attending this session. And I hope this was useful for everybody, just as it was for me. Thank you, ma'am. Thank you very much. Thank you, everybody.
Yeah, thank you. It was very nice catching up, Samirji.
Sure. Thank you very much, ma'am. It was a pleasure.
Thank you, doctor. Thank you so much.
Thank you.
Thanks.
Thank you, doctor.